Okay, so we're on tip number 3 of how to prepare for hip replacement surgery. And hip replacement, or number 3, is prepare your home.
Yes, that's a big one.
It is.
Always, always, always.
Yeah.
Yeah. You want to prepare your home doing things such as, what's your toilet height?
Yeah.
Because some of the precautions may prevent you from sitting down. Well, besides the pain and things, initially.
Right.
Going to be uncomfortable a little bit. May prevent you from sitting down on a low toilet. So you always want to check your toilet height. You may need a toilet riser.
Yeah.
You may need some handles, or you may need the combination of both for a good push off, because we certainly don't want you pushing off the toilet paper holder or grabbing a towel rack or something like that to get yourself up off the toilet.
And it does, something like that. We hear some of our patients, they're like, "Oh, I don't need something like that. I'm not that old or whatever." And it has really nothing to do with that.
No.
But if it's just for that time being.
Yeah, it's just temporary.
Trust us. you will thank us for that, for this piece of advice.
Right.
If you don't want to purchase it, because then you'll have it, check and see if there's a lending closet around.
Yeah.
You can borrow it. Lending closets, they collect gently used equipment and they refurbish it and they clean it, they sanitize it, and they lend it out to members of the community, and then they just give it back when they're done with it. So that's check on our website. On our resource page, we have a national directory of lending closets. Check there and see if you can find one closest to you and borrow pieces of equipment that you can get back when you're done recuperating. Okay,
right.
So moving on to that sense. So we did toilet height.
Yes, toilet height. You want to check your comfy chair height. Wherever you typically sit, it's probably, especially if it's a rocker recliner, it may be too low for you to get out of. So you either need to check into furniture risers. Sometimes people will build a little platform out of plywood and some 2x4s to raise their chair up. But you want to make sure that you have a nice level or a nice height of your comfy chair. And really, you probably need it at least up between 17 and 19 inches high, the seat height, to be able to get out. And sometimes that may be a little low for people right after surgery still.
Yeah.
But you want some place for your comfy chair, where all your command central is, to have a nice height for you to be able to get out of.
Yeah.
And then the other thing you want to check is your bed height. Is the bed going to be too high for you to get up into?
Yeah. Most beds are too high.
Yeah.
Just for anybody that, even though if you haven't had surgery, some of these beds are so high nowadays.
Right. So, you may need to look into trying to lower that bed. If you happen to be in the market for a new mattress before a surgery, you may want to look into ordering a low profile box spring, which is about 4 inches rather than the typical 6.
Yeah.
There are other ways to adjust with like an aerobic step and a handrail or a bed rail.
Yeah.
Or we call them bed canes now. They're small. So there are different ways to adjust, but you definitely want to talk to your therapist about that if you think the bed height's going to be too high.
Yeah.
And get that adjusted pre-surgery.
Yes, absolutely.
And then, of course, the therapist will be going over, if you have stairs to enter your home, they're going to be going over that before you leave.
Yeah. Occupational therapy, they'll kind of help you out with, they'll go through your activities of daily living in each room, and they can, items that you would frequently use, like in the bathroom or in the kitchen, bring those items out of the cupboard so that you don't have to bend over to get them out. And leave them on the countertop at least while you're recovering. So.
Yeah, and then of course you want to clear pathways, especially from the bed to the bathroom, from your comfy chair to the bathroom. You're going to be usually on a walker initially, so you want that pathway nice and wide. For I can't talk today, for a walker. Nice lighting, night light, so that you can see that path at night to the bathroom.
Yeah.
All kinds of things like that, just to prepare for your safety when you return home.